we have to come over. So, hello.
Hi, do I sit here or?
You can sit here or you can lie down. So, tell us why you're here.
For your treatment.
Well, no, I'm supposed to guess what I'm treating you for. What am I treating you for?
Well, I'm not sure. I suppose I might have depression. I cry all the time.
You cry all the time?
Yeah.
Okay. Well, did you cry all the time for me? Did you not cry right this second?
Well,
That means you're a liar all the time.
Yeah, I cry like anywhere, where I'm in yoga or.
So you're very sensitive?
Yeah, but it's been mostly in the last 3 years I've been more like this.
And are you crying because?
There's reasons behind
Okay,
it.
so
yeah.
there are actual reasons.
Yeah.
No, because some people say I just cry. I don't know why I'm
Sometimes
crying.
not,
but
but
just...
yeah, there are particular things there's lots that have gone on in my life. So
Okay.
more recently and stuff. Yeah.
Okay. What else?
I get pain. I've got bad shoulder.
Left one. Okay.
Like neck, and then my back. And I get quite stiff. I get pain. I can wake up with. It sometimes improves a little bit, but I get quite stiff and like I go to the gym. I exercise, but I'm still quite. I have to keep doing it, and because else I'm just in agony.
From the tightness.
Yeah, but sometimes I can just be waking up with pain. It's as though like sometimes I feel bruised.
Okay.
So whether it's just like the stress that's caused the pain or the tension, I don't know.
How's your digestion?
I've recently changed from being vegetarian from the age of 16. I'm now 43, but I'm now vegan. So I've recently done that the last few months.
Okay.
And I went to see this Reiki guy, and he says to give up dairy and eggs, but I just went vegan.
Well, if you gave up dairy and eggs, you are vegan. So
Yeah.
if you weren't eating meat, then you're left
So,
with this.
because he said something about that, and he says your lungs are not great. I was like, well, whether I can believe this guy or not, that's just
Well, that's
what
what
he
you've
says.
done. Okay. So that says something about what you eat. So you're a vegan, and you've been vegetarian for a long time. But the question is, how is your digestion? Do you have any problems with digestion?
I don't think so.
Okay. I'm just asking.
I mean, it goes in and it comes out. So I think too much, isn't it?
No, that's. It suggests that you probably don't have problems, because if you did, you would notice that
Like
on the way
yeah.
between in and out, there's some interesting thing that's in
Sometimes I get a
process.
little bit of pain, but not,
On the left side, lower left
yeah,
side.
I've noticed I do get a little bit of pain every now and then on this side, just like a little pain, but it's not like constant.
Anything else in medical history?
I've noticed whether more recent my period's changing, because like before, I don't know if this is relevant or not, because I've been coming to the acupuncture and thing, they always ask you about your period, so
So you
like
start to give them
before,
something
it's
to
like-
talk about.
well no, because they ask you that, I'm thinking, is that relevant then?
Everything is relevant.
And like
it
for
relates to
ages
you.
it was like quite sort of clotty and that, but I've noticed that it's just, since I've changed to being vegan, I don't know if that's just coincidence, but it just seems to be just like blood, not like too dark,
No
but
clots.
fresh.
Okay.
So I don't know if that's a good thing or a bad thing.
Is your period regular?
Yeah.
Okay.
And obviously I could be on my way out, because it could be like menopause. But who knows?
Teeny bit young for actual menopause nowadays. This was 50 years ago. You would be supposedly the right age, but most women nowadays are not.
I know my mum, I think she stopped when she was about 40, so like obviously,
Oh.
I don't know, but then she had pheochromatoma when she
Had what?
Is it a pheo? It's like a cyst on your adrenal glands, and the doctor don't know if she had, because she thought she'd like went through the menopause like really early, but they don't know if it's because maybe that was on a adrenal gland.
So the main reason you're coming is because you tend to cry a lot. You cry a lot.
I'm coming, well no, I'm coming because I have been quite regular, well I haven't been for ages, since about January, but before that I was coming. And I didn't really notice any sort of help having acupuncture, more than sometimes I did feel a bit calm. And then I hadn't been for a while, and then obviously I just thought, well maybe I'll give this a go, you know, and see if you can help me.
So where you're seeking help is the
For anything, but I mean I do get tearful, I do get fatigued sometimes, I do obviously get stressed, I get pain in shoulder, yeah.
Okay, so fatigue, stress, crying, and the left shoulder. And the lower back. Okay. Show, it looks like you're saying both sides like this.
Sort of here,
Okay.
and then
So
sometimes when I wake up it's all over.
Okay, so she's showing like this, and then she says around T7 also, sometimes, but the main thing is the PSIS, across the PSIS, which suggests immune. Okay? Let's have you lie down face up.
On the pillow. Up!
Face up.
I saw them there.
Immune.
Oh, thank you.
I'm going to take your socks.
I thought we got another grief.
I won't take them for you just now.
Immune. Special voice.
What happened here?
Here?
Yes. Taking any, were you crying? Were you taking antidepressants? Were you,
No, I wasn't taking anything then. I don't think I was crying then.
already given birth?
Yeah, I've already had my two
And they've already
kids,
done, yeah, okay. I'm just curious what the relationships might be.
Okay,
That's all.
that's
All
good.
right. Okay. Low
I
blood
can take
pressure?
this off if you want.
No,
or-
you're good. Low blood pressure?
I think I've always had low blood pressure. I was always told that, yeah.
She has very typical autonomic nervous system pulse. You know, you can't mistake it, so if somebody wants to take it, go for it. There's really very little mistaking here.
Yeah, go to it.
Any discomfort on Ren 15? Ren 12? How about here? No discomfort.
No, not really, no. Obviously you can feel your pressure.
Okay, compare this with this. Do you feel the same? It is what it is. It's totally okay. Oops. Okay, sorry. That was maybe tickle or startle. Okay. How about now? No, you don't like this.
Yeah, no.
Okay. And how about this? Not a big problem.
Not as bad, no.
Same as the first person. Left stomach, it's stomach 30. Okay. So it relates to the stomach 30 relates to the heart and the chest. Okay. So how about below kidney 16? You don't want that. Okay. How about here? Okay, listen. When I press here, you just feel my fingers? You're thinking very strongly, don't you?
Yeah, okay.
Okay. What do you feel when I press it? Do you just feel my fingers? Nothing spectacular?
Yeah, just feel you pressing into something.
Okay,
yeah.
fine. But no, here very clearly there's something
Yeah.
different. Okay.
Yeah, yeah.
Now, is there something different here also? No.
Not really, no.
Okay. Or here?
Yeah, there's a bit more there, yeah. But
Okay,
not
so
as
Ren
bad as...
6. Okay, so Ren, yeah, I understand. This one's way worse.
Ren
How about
6?
Ren 6. How about Ren 4?
It's not hurting, but it's
Okay.
not as pleasant. I mean, it's not...
Okay, so maybe Ren 4. We'll figure it out. Okay, no problem. You don't, okay, under the liver she doesn't like, and, whoops, please. This is okay? Yeah?
Yeah.
Okay, but this is not.
No.
Okay, fair enough. Any discomfort here when I press?
No.
No, okay. Anything on Ren 17?
Obviously, there's sort of pressure there, and I don't like you pressing there.
How,
But
so you don't like it?
I don't like it as
Okay.
in like who would like them anybody pressing in
You'd
that.
be surprised. There are people who might say, please.
Like, so you're going to put your hand through my chest, but,
No,
but it doesn't hurt.
Okay, yes, but for example, this you don't mind, and this you do mind.
A little bit.
Yeah, okay. So remember that, and we'll try and make. My job is to try and make this feels like I don't care. I don't mind.
Okay.
It's totally fine because this is we call anxiety reflex.
Is a dogma for Ren 17?
So anxiety reflex.
Yeah, are there treatment points within the dogma?
Oh, spleen and pericardium.
Thank you.
And then if that doesn't work, or you could start first with Sanja, release the neck. 1, 2, 3. Any discomfort?
It just feels a little bit sore, not like a bruisey.
Okay, which one feels bruisiest? 1, 2, 3.
The second and the
The
third is
second-
worse.
And the third is worse. Okay.
Yeah.
How about 1, 2, 3?
Not as bad as that side.
Okay. 1, 2, 3, 4. Okay, 2
Second,
obviously.
yeah.
Okay. How about 1, 2,
Yeah.
3? Okay, so C3 both sides, which suggests that her phrenic nerve is blocked, which is going to, it's going to be very difficult for her to release the diaphragm, which means it's going to be difficult for her to not cry because things get stuck because she basically you find it hard to breathe, kind of thing.
I have had an X-ray
Uh-huh.
on my neck, and they did say there's wear and tear on those parts.
Uh-huh.
So I don't know if that's relevant or
Okay.
not.
So there's arthritis,
They didn't say that.
but it okay. Wear and tear sounds like to me like arthritis. Okay. So this.
So is it just C3, Avi?
Yeah, C3 both
Both
sides.
sides, not the occiput?
I didn't check the occiput. 1, 2, yes, occiput as well. Boom, boom, boom. Yeah, occiput
All the way-
as well.
all the way
Yeah,
across.
yeah. All right. So, this is the big one here.
Yeah.
Sorry.
So that's inguinal, you press
That's
the
inguinal. Yeah, inguinal.
Inguinal.
Whichever. How is now? Not so good either. Is it not better? Or yes,
It
better?
doesn't. It's not too bad now. where
Okay,
you're
so
pressing.
liver 4. Okay, fine. Next. How's now? Spleen 4.
Well, it's still a little bit, but not too
Which
bad.
one does a better job? This one or this one? In terms of the inguinal pain, which one does a better job?
Maybe the second one.
This one. The-
Well, I don't know that one.
Okay. Number 1. We're only talking about how you feel here.
Yeah.
Number 1. Number 2.
Number 2.
Number 2. Okay. Fine. You had here, right?
Mhm.
And you have 1, 2, 3, 4. Correct? Okay.
2 and 4 are worse.
2 and 4. So 2. Okay. When I press on the foot, how is number 2?
Better.
By how much?
About half.
Half. And how is number 4? Sounds like it's gone.
No, I can still feel it.
How much is it better?
About half, I guess.
Half. Okay.
Yeah.
And this, how's this?
It's fine.
This
Well,
is-
I can still feel it a bit, but
Okay.
not much.
And this is better also, right?
Yeah,
How's the chest?
yeah.
Do you remember before you said I don't like it feels like you're going to go through my chest?
Yeah.
Does it still do that?
No, it feels a lot softer.
Great. Okay. Number 4. Next.
So liver 4, why were you going to liver?
I started with inguinal. I was thinking maybe spleen 4 because of Qi Chong. Stomach 30 is called Qi Chong. So spleen 4 is Chong, right? So I was thinking maybe I can get away, I can do pericardium 6, spleen 4 kind of thing. But liver 4 proved to be a better point up to now. Hold on 1 second. Just one. You didn't like this,
No, I
right?
don't like
Okay. Question. How is it now?
that. Better.
By how much?
A lot.
Also?
Yeah.
Okay. So even though she does no liver 2 pain, right?
That doesn't hurt. No.
Okay, I'm just checking. Still, since both liver 4 and liver 8, it almost feels like she should have liver 2 pain, but she doesn't. You know, it happens like that. Okay, so good friend of liver is pericardium. Any discomfort here? How's now?
Yeah, it's fine.
How is, no, that didn't do it, but hold on. Any discomfort? Maybe.
Just a little bit, yeah, but
Okay.
not. I wouldn't say discomfort. It's
That's
just
okay.
you could just feel it.
Okay. How is this fine now?
But yeah.
Okay, so pericardium 3, because I'm going to do 3 and 5. 4 on that side and pericardium 3 and 5. I mean, 4 on this side and 3 and 5, which is metal water on the left side. Okay, and how do I know that it's correct, quote unquote? You know, because when I press on 3, pericardium 3, inguinal goes away. Okay, I know it came back a teeny bit, but still but still better than it was, right? So she is not often the Shen type people are spleen pericardium axis. She's a little bit different. She happens to be, and that's why I asked her about digestion, by the way. You know, but she says no. It comes one end, it goes out the other end. So in her case, it's more liver. You know, liver spleen axis. Okay. Let's see what we look at here. So, oh, and it's the left shoulder, right?
Yeah.
Okay, where is the pain?
All
Oh, okay.
sort of neck and all the way
Okay.
down. Yeah.
Relax. Tell me if I'm hitting on something uncomfortable.
Yeah,
There. Okay. How's that?
Yeah.
It's good?
Yeah.
Okay. So we have a confirmation. Let's start and see what happens. Yeah.
I usually think right shoulder liver,
Ah.
left shoulder.
Yes, but I know it's supposed to be cardiac or muscle. Yes, that's true. However, she actually shows liver. So the thing, you know, it's not ideal. So when you say, yeah. So if somebody comes and says I have right shoulder, then you say, oh, I wonder if it's a clue to go check the liver. But in her case, she shows liver already. Liver has proven to work for other things, and it also happens to do the shoulder. So it has nothing to, it's, so you can say it's the liver channel, or I don't know, but clearly liver 4, listen, this is also left side, and liver 4 is working on the area.
Yeah.
So,
And I was wondering why
yeah.
why did you go for spleen 4 rather than spleen 6 or the
to do the blood pressure, well, okay, because if I was going to do spleen 6, spleen 9 under the third toe, we'd be doing the same treatment on the third person in a row.
Oh right. So you were just showing, but
that reasoning.
maybe you would
I
have
could
spleen
have
6.
totally tried to do that. I mean, I don't know if it would have worked, but you know, when you're in your clinic and you're doing the same thing on everyone, you go, okay, fine, it's one of those days, everybody's getting the same treatment, happens. You know, maybe they're getting the same treatment for the rest of the week. It can happen. But when you're teaching and you're doing the same, you can't keep doing the same thing. It's just
Reinforcement,
reinforcement. Ah, okay. Would you like spleen 6 or would you? It's much nicer that we now have a liver pericardium combination as opposed to.
Right,
So-
it's very interesting the way she jumped when you pressed the liver, because you could almost say it was like liver excess already. It was a sharp
Yes,
stabbing
yes.
pain.
And
Which
yes.
makes you think liver 2 wasn't sore, but
Well, no, but there's other liver excesses that have nothing to do with liver too sore. In
Yeah.
fact, if it was true, see, if I thought she was true liver, and she could be. By the way, you said nothing here, right? Oops, maybe I missed.
It doesn't hurt.
It doesn't
It's
hurt.
just obviously a pressure.
Okay, and but you had something here. Did you
Yeah,
say?
yeah.
Fine. Okay, fine. How is that one?
Still a little bit sore.
But how much? So it's better if it's.
A little bit,
By
but not a lot.
Can you? Let's talk
About-
percentages.
75.
75 left or 75 gone?
Do it again. about 50 now, yeah.
So 50, that's obvious, 50 gone. I just need to know if you tell me what's gone, if that, how much is
Yeah,
left
but
or how much is
I
gone.
did think 75 is still there when you,
But then it got better?
yeah.
Oh, fair enough.
Now, when you liver reflex was a
Mhm.
bit tighter, at which point would you be asking a question like, oh, have you had a lot of medications like antibiotics?
I could,
and-
right there and then I can
Yeah,
ask.
okay.
But she didn't run, well, she had a lot of medications.
Yeah.
You have said you were on antidepressants for
Yeah,
14
it was,
years.
yeah.
Yeah, but that was a long while ago. And I have sort of dabbled, like every now and then I'll try it and then I'll like, last for like a week or so and then just, yeah.
Okay.
But I haven't been on them properly for years.
Kidney nine's on the list, don't worry.
Yeah.
Maybe I should be on them, but you know, I'm trying other things.
No, I
So with the phrenic nerve,
uh-huh.
are you going to release the C with the L4?
I thought it was, I think, okay. How's this now?
Not too bad.
So
It's
there's
still
some.
sore, yeah,
Okay,
yeah.
fine, no worries.
Probably
no worries.
about 60.
Okay. Ah, now she's getting to the percentages, very good.
So Liverpool before, that's what you've done.
Right now I've done liver, and I'll consider because we did check liver 8 and it seemed to have worked. So how is this side now?
That's okay then.
But this one is still something.
Yeah, a little bit now.
And how's the occiput?
That's just pressure at the moment.
Okay. And this side occiput.
That's fine.
That's fine. Okay, so a little bit still left there. Okay. So you have here you still have, correct?
A little bit, yeah.
Okay. And how's this guy?
Yeah.
It's okay? All right. And this guy is okay now? Not so? Not so much? Okay. Okay. How's now?
Yeah, I just feel your sort of pressure.
Okay.
Where are you?
Liver eight.
Yes.
Right?
No, no.
Liver
Liver 8. Liver 8.
Right.
Um, so liver 8 should have like a little nodule feeling on it. Okay. So there should be a little bump there. How are we doing with this one?
Still a little bit.
Still a little bit? Okay. Can you tell me by percentage how much is left?
You're rubbing like
Okay.
slightly on the thing. That just feels like pressure when you direct there.
Okay.
It was there.
This one's okay now?
Yeah.
Okay. This one.
Yeah.
They're okay?
Yeah.
All right. And you had left here. How's that?
That's okay.
That's okay?
Yeah.
Okay. So the only one that we have left is this guy, correct?
That doesn't hurt at the moment when you press
Okay.
it.
All right.
And both C3s are okay.
Both C3s are okay.
And the
now, and the
occiput.
occipits. I'll check the left one again. 1, 2, 3. It's okay?
Yeah, that's fine,
Okay, good. You saying
yeah.
that?
Just a little bit.
Okay.
A little bit.
How's now?
Yes.
Yes. Good.
Maybe there's about 10 minutes.
Okay. 10. And if I go for this side,
Yeah.
it's good? Okay. So I'll add kidney 10. Why? Because number one, if I'm crying all the time, how can I occupy my own house?
Yeah.
Number one. And number two, kidney 9, good for because of the medications, but possibility that because she has liver, maybe let's add kidney 9 and help clean the liver up a little bit more.
So potentially, did you have normal births? Did you have
Yeah.
and no problems? Not lose too much blood or anything like that?
I think I lost a bit, yeah, I lost a bit with my first one, but not with the second.
And were you okay? Did you have postnatal depression or anything like that?
Yeah.
I was just wondering, you know, if you had it cut out here and...
Right,
postnatal.
yeah. It's okay, yeah, because she never, yeah, because you know, that seems like the big thing to go against is this weird infection in pregnancy. You know, you think that would give quite a shock to the system. And unfortunately she doesn't, she's not cooperating with the idea. So, no, and that's the thing, you know, you
If
have
that was
ideas.
the thing, would you be going for spleen? You could be going for...
If she, then I have to start thinking what I, you know, I haven't thought so far as what would I do if I found it. You know, because then it would depend on possibly more things to look at. But, you know, it's hard to know. But, because then I have to think, is it the piercing, is it the trauma, is it the infection, is it the, you know, there's more options around it. Including, for example, no, don't have. Any yes,
Yeah.
okay, including, for example, UB43. Because that's Kibi 16 is Wang Shu, and this is Gao Wang Shu.
Yeah.
So they connect with each other. Or instead, UB53, I think it's called Bao Wang. Okay, so she has both these Wangs. I don't know, you brought up the Wangs before, but nothing had nothing to do. She wasn't even in the room yet. So, are you comfortable?
Yeah.
All right.
Yeah, obviously my shoulder hurts a bit, but that's normal, it always does.
Oh, wait. Are you talking about this?
Yeah, yeah.
I thought, okay, I'm sorry. I thought that was kind of, at some point you said it was gone, so it's still there.
It's like when you were pressing it, I suppose I answered that part, but I tend to, any treatment I have, if I'm lying down, I'm okay for a few minutes and then it starts to hurt.
Ah, okay. Because you said obviously.
Sorry.
No, it's obvious to you. It's very obvious to you. Okay, gotcha.
Yeah.
Okay, so the shoulder is hurting right now, correct?
It's like it aches away and yeah, it hurts.
And how's now?
Don't know, I can still feel.
Okay, then it's no. Okay, no is acceptable.
I mean, it's not hurt, it just feels as though that hurts.
Forget about that. How's the shoulder?
A
Heart
bit
3.
better.
A bit better.
You know, like my shoulder, because it's like my shoulder, it's as though that it's stuck, as in it's in the wrong place. You know, like it's.
When you say the shoulder, do you mean this or do you mean the
It
shoulder
never-
blade?
Obviously, it hurts at the. I don't want to move my thing.
It's
But
okay,
it hurts on like. It's all sort of stiff and hurts at the top, or aches.
This?
Yeah.
Okay.
But obviously, my shoulder is rubbish, and I feel as though. that-
Obviously, my shoulder is rubbish. Okay.
So
Very
whether
obvious.
it's not in the right place, do you
Okay.
know what I mean? It's as though
Okay,
it's,
so it's like the shoulder blade, which is this part.
you know, like obviously you've got your ball and thingy joints.
Yeah.
It's as though that it's not quite right, whether it's damaged or
Okay.
grinding away, or
Let me
whether
ask you
I've got a
something.
ligament.
Do you feel okay? Do you feel this is the weird part, or do you feel inside here is the weird part?
It's all a sort of a way around it, and yeah, this round there. Just feels sort of in here and around. It's all kind of crunchy.
I don't need to press on it. You feel it on your own, right? That it's weird.
Shoulder.
The shoulder. Yeah.
It's,
This part feels weird. I don't need to press on it for you to feel. You just feel that it's
You
weird,
are,
right?
yeah.
Okay.
You sure?
This is sort of okay now?
yeah.
Okay.
The more you press down on it, it hurts a little bit.
Okay.
But
Can you ignore that and tell me if the feeling of the shoulder being in the wrong place, out of place, is that feeling getting easier?
no.
No. Okay.
It's like the whole capsule, is that what she's saying?
Yeah.
The whole thing here rather than the blade.
I mean, I've had physio and that over a year ago on both my shoulders and my back, and I did do lots of exercises. This one improved, but this one didn't.
In-house now.
That blood pressure, didn't she? Didn't she say?
She has low blood pressure.
No, she didn't.
Yeah.
What about the immune, because there was immune back bit, wasn't
You can
there?
try. Oh, yeah, she is, sorry. Okay, that didn't do it. And now? She already has understood,
kinda
so I
just-
can't do it
It
again.
kind of feels like
Does
the
she
shoulder
have
hurts sort of
No,
more
you
down
tried it.
down here now.
Sorry?
You know, as you move my arm, it kind of hurts a bit more down here now.
Okay.
But
Let's do immune because she had that immune back thing, and then I'll be able to look at the shoulder better on the other side, because I want to see what's going on there, because it's just a little bit unclear to me. So that's another big, yeah, sorry?
Did you say immune back?
Immune, because, she has across the PSIS.
Yeah,
She
okay.
says her pain
Oh,
like
okay.
this, and then
Yeah.
something she has around T7. Let's look at the back sort of separate, in a moment separately, because there's just too much, there's not enough clarity for me right now as to what's going on with the shoulder.
Should I take Anna's needles out?
Yes, I was going to do it right. Well, you okay?
yeah,
Sorry.
that one hurt a little bit. But
Yeah,
you know,
sorry.
like when you pressed them, that one they were quite tender.
Yes,
those ones.
yes,
Yeah.
that's quite
Which
common.
might be
for-
good, is it? Is that good?
It's just the way it is. It's
Okay.
not necessarily good or bad, it just is.
Okay, thank
Are
you.
you comfortable?
Yeah.
Do you want to cover?
I'm all right, thanks.
All right. All right. Let's have you sit up and test out the shoulder again. Well, you can take that with you if you want. I'll take that if you want. You don't want to? Okay. Relax. All right, stand up and lift your arm. Okay, it definitely is. Do you want to take it sideways? But I suggest when you take it sideways, to turn the palm. Yeah, don't overturn. Okay. Sit on the table. So first of all, I want to stretch out, and then we'll see what else we can do. All right. Sit up straight. Not overly straight. Look to the left. Now look to the right.
Sorry. Oh, sorry. Do beg your pardon.
Look to the left. Slowly look to the right. There'll be a huge stretch into the ear and the eye on the left side. Are you feeling? Don't look up. Do not look up. Drop the chin. Drop the chin. Drop the chin. Okay, good. Okay. Now, start looking towards the left, and the stretch will probably be more intense on this side. Go ahead. Don't look up. Drop the chin. Drop the nose down slightly. Yes, and keep going to the left. Yes. Is it intense?
Yeah.
Okay, just breathe.
Keep breathing.
Forget to breathe.
Don't forget, don't talk, because you can't breathe and talk. See if you can turn a little bit more. Don't worry if you can't. Good. Okay. Now lift the arm again. Well, stand up. Don't do it sitting because then she couldn't. You know, so she's trying to lift first. Okay. Anybody wants to give her a ride? All right. Let's do one more thing. See if that helps.
Just woken up. I think I've just woken up.
That's okay. Go ahead and lift the arm. Okay, is there pain? Or just restricted? Okay, okay. So what happens is unable to slide the shoulder blade down. I'm kind of forcing the shoulder blade down for her. Okay? So, so what you want to do is you want to recognize in your thinking pattern that when you're trying to lift the arm, you're trying to do this and then this. And what you actually want to do is send this down and then let this glide. No. You're still trying to, you're thinking too much here. Do not worry about this at all. Think of reaching your fingertips down to the floor and then away from you. But this keeps going down. Okay. Send them away. No. Let go of this. Don't worry about this. Send the fingertips away. Send the fingertips away. Send the fingertips away. Send them away. Send them away. Send this down. Send the fingertips away. Easier?
It's uncomfortable.
Okay. But is it more comfortable than before?
Yeah.
Okay. I mean, no, doing that. I mean, because it's a whole different pattern for you. Because you're so used to lift the arm, but the arm didn't lift. You know what I'm saying? So you have to recognize this stays where it is, and the arm turns in the shoulder. In the socket, the arm will move. But see if you can make the arm, no, relax the arm. Yes. See if you can do this. Relax here. Relax here. See if you can do this. Just lift it from here. Send this down. Lift from here. Now hold right here. Yes. So see if you can lift now from here too. Send the fingertips away from the waist. The fingertips away from the waist. The waist away from the fingertips. How's that?
Yeah, that's really legs here.
Okay. So I would say lots of outer UB line, if you can, and maybe, see what one could do there. All right, thank you for coming.
Thank you.
Take your time, you don't have to rush out.
Thank you.
We'll take a few more minutes and then we'll get you. Do you want to take a 5-minute break now?
Yeah.
Yeah, let's do that because then we'll be ready. Low blood pressure is definitely a bit of an epidemic. Does that make sense?
They take it very seriously in Germany if someone comes in.
Oh.
Over here they tend to go, ooh.
They say good,
You're not
yes.
stressed.
Yeah. In the States also. They think it's a good thing that you have low blood pressure. No, I don't think it is. I think it's not a good thing. I think it's not dangerous, unless it gets really low. I mean, so like I was hospitalized and I had a blood pressure, so when I got up, I actually fainted. It happened twice in a row. And it was not orthostatic because I was standing up for like a while. It happened like 5 minutes later and I just totally dropped. And the next day my blood pressure was, I don't know what it was at the time because by the time they got me, it was up. But the next day they measured it, at one point it was 50/30.
Wow.
That they cared about.
Yeah.
But when I went home and my blood pressure never got over 90/50 or 90/60, everybody was, oh, well that's good. I'm like, no, that's not good. And this went on for months. And everybody thought, oh, that's totally fine. It's a good thing. Like, you've got to be kidding. There's nothing good about it.
Yeah.
But they don't, so they take it seriously when you're fainting, low blood pressure. But otherwise, it's not meaningful.
How did you feel? Did you not feel right at that blood pressure?
It'll be
Did,
fine.
did you feel something was not right?
I felt weak, but I mean, it was a little unfair. I mean, I was in the hospital before, so it wasn't like, you know, oh yeah, I'm supposed to feel great. So I felt uncomfortable to begin with. But yeah, it's, I felt disoriented, I would say. You know, but maybe it wasn't due just to the blood pressure. I mean, I can't guarantee that it was just due to blood pressure. I can't say. But, well, I can tell you how I felt when it was 50/30. I was on the ground. That's how I felt. So,
Did you pass out, or did you just go down? Did you lose consciousness?
I lost consciousness. I mean, I gained it within a second, but
Yeah.
I was, you know, but well, actually, no, because I know they told me that I fell twice in the same episode, and I only remember once. So I obviously passed out for however long it was to fall twice. So low blood pressure is not a good thing. There's too many systems that work on blood pressure, and you need it, whether it's for digestion or you need blood pressure. It's not something that you don't need. It's like you don't need it too high. Yes, you don't want to get a stroke, but. So again, with blood pressure, people who have 140/85 are not likely to get a stroke. That's not exactly a stroke level blood pressure. And especially the other thing is, many people with high blood pressure have a perfectly acceptable diastolic. It's not even above 80. But their systolic goes about, once their systolic goes above 135, 140, people want to put them on medication. It's like, it's absurd, because it's the diastolic that really should count, in my humble opinion. I don't hold a medical degree, I can't, but that's my understanding. And so I think we tend to rush people into making decisions because, everybody, you need to cover your ass as a medical establishment. So this is what, okay, you're above 140, systolic, well, you should go on blood pressure medications. So it's not very good that they do that, in my opinion, but that is kind of like the standard. So we're pressuring people into these blood pressure medications.
So what can you do for low blood pressure in terms of lifestyle, and do you encourage them to eat more salt or something?
I don't think that's a lifestyle.
Stop smoking?
No, I think you just have to accept, I think the thing is you have to accept that's a nervous system. For the low blood pressure type is almost, let's say 85% of the low blood pressure types are autonomic nervous system types. It is an autonomic nervous system disorder rather than just a pure circulatory. So what you can do is, so it's kind of odd because, well, if you meditate, that's supposed to lower your blood pressure, right? That's the thing. But I think it tunes the nervous system. So I think, yeah, meditate, do yoga maybe. But the thing is also, to some extent, just accept the fact that, in terms of lifestyle, I'm not sure, but in terms of acupuncture, tune up make the nervous system more pliable, more flexible, more capable of responding to situations rather than always like going into, this nervous, because that's what they tend to be. They either don't respond at all, like they seem like totally parasympathetic mode, which is rare, but there are those, or they're kind of jittery in a weird, they're not jittery like in a totally, that kind of way, but they are jittery. It's a little more subtle than what people think of as the jittery of high blood pressure. But they're still just as jittery, and they're just as anxious. So yeah, something like meditation, because what you're doing is you're taking away the constant expression of it. So the underlying cause may still be there, but you took away the expression because you give, through meditation, you're creating at least a certain period of time in the day where the nervous system doesn't get to do that, doesn't get to express that. Then there's a chance it can re-educate itself. You can't expect, I don't think it's appropriate to tell people or to expect from people, for them to expect themselves, to make it 100%, that it's a constant phenomenon. You start with even 5 minutes of it and give the body the message. And the body goes, oh, okay, I can handle this, maybe I can, and then it's 10 minutes, then it's 15 minutes, then it's 30 minutes, and then it's, no, it doesn't happen so often. I mean, you know, slowly, the nervous system is not going to switch like that. Some things, like shoulders, they can switch like that. The nervous system will not switch. It just, you know, it's like it gets a message. I often talk about the Pavlov dog phenomenon. Okay, you give somebody an injection in the right butt every day at 12 noon. On day 31, you don't need to give them an injection of the right butt. At 12 noon, the right butt's going to hurt. You know, it's just the nature of it. Because the system got used to it. It's the same way with taking away pain or something. You take the pain away or you take the problem away for 5 minutes even. Because an injection doesn't hurt for all day. You know, it hurts when they do it, and a few minutes later. You release the pressure valve. You release the tension or whatever. Because low blood pressure is a certain kind of tension, even though it's low blood pressure. You release it, you open it, and it opens for a little bit, and it goes back to the pattern. But every time you open it, it gives the body a chance to settle into the pattern a little bit more comfortably. And then one day, it may not settle where you want it, but it will settle maybe in a better position than it was before on a sort of more permanent basis. And then again, and it will settle again and again and again. Maybe one day it will get to a point where it's ideal. What's ideal? You know, it's about the person in their lives, not about numbers.
So differentiating between what you're saying about the nervous system and the low blood pressure, the nervous system treatment, are you talking about the Sanjiao and
The nerve, yeah, okay, so autonomic nervous system, you know, the primary components of it can be, pericardium is included in that, but the spleen will not. So the spleen points of the blood pressure treatment are not part of autonomic nervous system. But under the third toe is, okay, even though it's primarily a blood pressure point, it doesn't always have to be for blood pressure, but especially rapid pulse. It's a very good point for autonomic nervous system issues, primarily for people who are quote-unquote sympathetic dominant. The autonomic nervous system type will have a tight SCM or tight neck in general, and that's, yes, that is the Sanjiao 8 or Sanjiao 5 type. And on the back, it's due to T5, T7. It's plying out the back, the spine, to soothe out the nervous system. And part of it is Smoitus 910, because Smoitus 910 spreads out the back, it opens up the spine, therefore opens up the nervous system. Okay? Yes?
Just as an autonomic nervous system, low blood pressure person,
Uh-huh.
I think that meditation is a great idea, but I think the first step, people like me and others, is deep relaxation. Because it's very difficult for somebody who's slightly autonomic nervous system and hyped up to relax. And so a bit of lying in corpse posture or something, or crocodile, something to relax first. Because
What's crocodile?
Crocodile. Well, you're on your front.
Oh,
Corpse posture is on
like
your back.
Shavasana, but
Savasana
but on the front.
Karasana.
Got you.
Yeah,
Okay.
but because it's harder to meditate if you're not relaxed, and so a person like
different people have different experiences with that. I will say that, for example, I'm obviously a low blood pressure type because it's proven. For me, sitting meditation, no problem.
yes,
But I've had a lot of training, granted.
you're relaxed.
Well, no, but I will say this, that somebody tries to lead me through total relaxation, through deep relaxation, I get so pissed off. I will get up and, other people like snoring. So nice, somebody is leading me, they're singing to me, I feel so nice.
You don't like
It's
being
annoying as hell!
But you don't like being told what to do. It takes 9 months. It takes.
That's true too, but that's a different
Personal experience.
story.
I lay there for sort of 6 months being told to tense and relax this and that, and I kept
Oh no,
saying
but
in
that
my
I
mind.
could do, that I could do.
Yeah, but I kept saying in my mind, I'll do. F off, I shall do what I want to, you know. But I think about 6 a month and 1 day into it, I thought I was a bit weary. I thought, I can't fight it, I'll just listen to it. And I sunk into the floor, and I didn't want to come back. And then that's a great prep. Once they're in that stage, meditation is much better for a person who's...
And I think that's the thing, that everybody has different, because I had no problems with people telling me what to do for meditation.
You don't mind it?
I didn't seem to care. I mean, you know, I obviously did it. I went through it without rebelling. So I just think that everybody is different. But yeah, I mean, I would consider something like deep relaxation or meditation or yoga all to be, they're not the same, there are definitely distinctions. I don't want to lump them all in one. But in terms of the nervous system, I actually know people who say, find your meditation. And if your meditation is knitting, that's fine. If your meditation is fixing a car, that's fine. Meditation is not this. Okay? That is just one form. You know, what is your capacity of recognizing what's in the foreground, what's in the background of the mind? That's what it's about. So then the nervous system starts being able to distinguish, this is in the background, and my nervous system latches on and puts it in the foreground. That's what that's about. So therefore it tunes the nervous system. Yes, that's different than total relaxation, granted. But they still serve, from the purpose of the nervous system, they often serve the same purpose. How are you doing?
I'm okay.
You're okay? Good. Let's see what we can do in the back for you. You look at the shoulder. Can you take, do you have something underneath you can take this one?
I've got a bra, is that right?
If that's right, that's...
Yeah, I don't mind.
That's, yeah. Because I want to be able to see what's going on in that shoulder. A little bit better. Okay. Feel is lifted. What do you think? What do you feel in this shoulder blade?
It's just, it never feels right.
Okay. Relax. Does that feel righter?
A little bit, yeah.
Okay. Does that feel right? Or does it still feel all screwed up?
That feels a bit painful.
A bit painful. Okay. Where?
At the top it was.
Hmm?
At the top.
Here?
Yeah.
Or here?
There it hurts there, but...
So, relax. Doing this hurts here?
Yeah, and at the front of it a bit.
Oh, okay.
I'm not really sure.
Okay. Well, it's just that we can put something underneath so the shoulder doesn't roll, you know, that's okay. So it feels a little odd there, right? And you had pain 1, 2, and 3, correct?
Mm-hmm.
Okay, especially 1?
Yeah,
Oh.
okay.
Oh.
Yeah.
Oh, right. Okay, she's this type. Remember she was the liver type on the front? The people who, when you touch around the spine, they jump like hell, those are generally liver types. Okay. Sorry. Okay. How is 1, 2, and 3?
Yeah, that's fine.
Sorry?
That's better, yeah.
Better?
Mm-hmm.
Lots better?
Yeah.
Okay. Hold on.
What was that you pressing?
Oh, yeah.
Was it a 4 corner, that one, Abby?
No. This is UB 40, 42, 43, 44.
Oh,
area.
sorry. What about the bottom that you were pressing?
The bottom is more sacroiliac, and what I'm relating it to, what I'm saying is, it's, hold on, I'm just going to put the needles up. That will be Bao Wang. UB 53, I think, is the number, or 54. It's called, so this one is called Huang, Gao Wang Shu. Around her navel, where she has this injury, is Huang Shu, kidney 16 is called Huang Shu. This is called Gao Wang Shu, and this is called Bao Wang. What's common to all of them is the Huang character, which is something that's missing or buried in the body. The character Huang is something, is Wang as in missing in the body. Okay? Therefore, you can say related to ancestry, because what is going to have a Shu point that's missing, that's dead, that's buried, but is also in your body? Your ancestors. Most of them are dead. I mean, 99.9999% of them, even if your parents and grandparents and great-grandparents are alive, still most of them are gone. Okay? So,
And how do you find that point?
I basically take what I think is UB52 and go outside and slide onto the ligaments.
And how do you find UB52?
No, that's 32.
Oh, 32.
Well, okay,
Oh, okay.
okay, this is the end of the sacrum. It's going to be somewhere around here. Is it here? Is it here? Is it? Just find the gummy on the sacroiliac and call it Bao Wang. I mean, who's going to prove you wrong? Especially if, how is this now?
Yeah, fine.
I'm sorry?
It's fine where you're pressing it.
Uh-huh.
Obviously my shoulder still hurts.
Yeah,
But
okay.
the way you're pressing it.
It's not obvious because I don't know. It's obvious to you.
Yeah, sorry. Just shoot.
No, these are expressions I have to think. When someone says obviously, I'm thinking, they must think that I know. And why do they think I know? And then I'm realizing, no, it's just an expression that people use. It's not obvious at all. What do you mean, obviously? Obviously, my shoulder still hurts.
And that's what she's way down the
How did you think?
Thank you.
Now, luckily, the people who like jump, so she'll,
Level
yeah, she jumps here, but she probably, oh, she jumps here too, okay. Because the liver types tend to not, oh, okay, okay. They tend not to jump above T7 so much. It tends to get a little calm, but it didn't, so, okay. So, jumpy, okay. Let's treat the autonomic nervous system from, the tailbone. So, okay. It seems like you're still jumping, I know, but it seems like it's a little bit better. Is that correct?
A tiny bit.
A tiny bit. Okay, fine, no problem. How's that?
Yeah, a little bit better.
A little bit better? Okay. So UB36, remember I told you, people don't like sitting on their thighs. So we're not activating UB36, and therefore the whole body sort of, you're shortening in the hamstring because you're really not using UB36. UB36, by the way, its name is Cheng Fu, supporting the support, double support. Okay? So I know people, people generally don't want to deal with it. Lovely name, but do I really want to needle UB36 kind of thing? A lot of people think. I don't have a problem, personally, but how's now? I know you jumped a teeny bit, but it's a little better.
Yeah.
Okay.
Would you ever say, I don't know if you can assess when somebody's prone like this, are the scoliosis of the spine or not? Because just looking from here,
There's a curve here.
A little, yeah,
Yes.
right, there is. So I didn't know.
Yeah, I agree with you. There's a curve here, and there's much more tension in the muscles here than here. Her neck is pretty off. But I don't, it's not my profession, so I don't really. All I can do is notice.
Yeah.
I've been to chiropractors, I've been about, and they said there's nothing wrong with you. Do you know what I mean? So,
Yeah.
so
Honey, there's nothing wrong
I'm going to
with
go
you.
back to the.
There is.
Do you know
So
what?
she said,
It's just how you like.
So she said, I'm going to acupuncture where they can find something wrong with me, damn it. I don't go to these people who say there's nothing wrong with you. Okay, how does your shoulder feel right now? Because it's something I can't palpate, so I have to ask.
As in, it still doesn't feel as though it's in the right position, but
It feels as
it
if it
feels
is
as
in
though
the right
it's-
position. It's not.
I don't think it ever will be. But
Okay.
it feels as though, like, when it's here, it's better with this thing
Yes,
here.
yes, of course.
But it still feels as though it's grinding, like
Okay.
like the bones sort of gone
Okay.
in with a bit of a ligament or something
Okay,
as well.
okay. So it still feels grindy-ish.
Yeah, sort of.
But not there, but
No, I
up
know,
below the ball
inside
bit,
here, I
yeah.
know. These are great for deltoid, okay? So, now that they're not painful, I can play with them. Okay, how's the grindy feeling?
Yes,
Yes,
it
what?
still doesn't feel right.
Okay, my question is, are we moving in a direction towards feeling righter or not?
No.
No, okay, that's all that's, and now?
Possibly a tiny fraction.
Now?
I think it might be opening it up a bit, but that's more painful where you're pressing.
Okay. Whoa. Okay. How's grindy?
No, I don't think so.
Sorry?
Um,
You're talking towards the floor, that's why it's hard for me
I'm
to
not
hear.
sure. I'm not sure.
You're not sure. Okay, not sure may suggest that it might be useful. I mean, it'd be nice if you said, oh yeah, I'm sure it's great.
Yeah.
But that's not what you're saying, but it might be, hold on, it's okay. Small intestine 9-10 on both sides, because she is, after all, autonomic nervous system. Yeah. Where are we at with the shoulder feeling? Yes?
It just feels funny inside still.
Okay. So
I
let's...
can't even describe it really.
No, okay, do not describe it. What I want you to do is that uncomfortable feeling, we're going to call it a 10 right now. That's a 10, okay? 0 means it feels no problem at all, I don't care, okay? So I'm not going to ask you to describe it, I'm just going to ask you to give it a number. And the number is subjective, meaning you're the one who's giving it the number, no one else, okay? No one can check to know whether it's the right number or the wrong number. Okay, and how's the shoulder now? I'm waiting for a number.
It hasn't changed.
Okay, so you just tell me. Okay, so it's a 10, it's no problem at all.
Yeah.
And now? Hi. You're debating?
Yeah, because you get a different pain and then you're like trying to...
Then your job is to just keep being with the shoulder regardless of what else I'm pressing. Your job is to stay here and let me know what's going on.
Maybe a little bit improvement.
A little bit improved, okay. Okay. And now?
Yeah, improvement.
That's pretty good.
Yeah.
Okay, we're going to have to wait for that one so we can turn you back to the front. Okay, that's stomach 9. Okay, because she had the C3 on both sides, so there's a chance that, stomach 9 would have done it. That's why. So we'll just wait and, until we have an opportunity. Yeah?
We use finger pressure on third toe. Have we needled third toe?
I haven't, and she is the type, so let's go for it. Can't do any harm, can it? Excuse me. Oh.
Let this happen.
I think another time, perhaps.
Do you want to look at this anymore?
No, we can,
Then I'll do it.
something happened to it.
Well, it wants to.
Oh, they've got an update, okay.
I'll let it do it.
He needs to go, I have to go
At 6. That's okay, so we'll do what we can until 6.
Oh, okay.
And then we'll come on that.